understand that several of us are not here, and how many have had lunch? That's what I thought. Oh, I'm sorry, Big Man's had lunch, but he's my bodyguard. Ain't got an apple. Yeah, go ahead and cut that and share it if you don't mind. But thank you all. I know there's a lot going on. I appreciate you coming. We do have a quorum, so we're going to get started. Today, Representative Jones is here with House Bill, his substitute to House Bill 219. 219 was his original bill number, and then after he dropped that bill, he has made some changes in it. And since we didn't hear the first bill, there's no point in talking about the first bill. We'll just go straight into the substitute. And let me see, we got, which one is it? I got two substitutes. Representative Jones, I'll let you get started, and you call out the substitute number that you're actually speaking from. Yep, got to push your button.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. We're actually dealing with substitute LC400816ERS. Be sure everybody's got the right version. Just a little bit of history about what happened.
Let me interrupt you.
Sure.
First. We've talked about this, Representative and I have talked about this, and we're not going to have a vote on this today. We're just going to have discussion, and we've got many people who have signed up to speak on it. If you want to speak and you hadn't signed up, please come do so. But there's a little bit of confusion, and I thought after he and I talked, we both agreed that we would hear it today and see if there's some changes need to be made before a vote comes up. Okay. Sorry to interrupt you. Thanks.
That's quite all right. Because certainly jumping ahead to the Chairman's comments, we want to be sure that the bill is clean and the language is clear and there aren't some unintended consequences as a result of these changes. The original bill from which my bill was introduced was put into effect in 1999-2000, and it basically at that time excluded privately owned pools from regulation by county health departments. The whole premise there is that you got a private pool, it's not public, not made open to the public, therefore the county health departments should have no jurisdiction over those pools. So the genesis of the change to this bill was actually to add the word condominium as an additional private ownership group that would be excluded from county health department regulation. As this has kind of progressed, it became clear that perhaps what we needed to do was to, and there, let me interject myself, there actually was an exclusion in here that said those counties that had governing regulations in effect as of December 31st, 2000 would not be covered by this bill. So again, in further discussions and research and conversations, it appeared that, again, the intent of pulling private pools out from the regulation of county health departments made very good sense. And that it made sense also to remove that grandfathering clause and make, therefore, all private pools to be excluded from county health department regulation. One caveat in this bill that existed before was clarified in this version is that members of an HOA, let's say, people who own a condominium unit or a townhouse unit, had the right to contact their local county health departments if they felt that their pool was not clean, unsafe, had some issues with it, that those private property owners could contact health departments, request an inspection of the pool, have the pool tested, and have the county health department actually issue a determination as to their findings as to the pool. The condition, though, of that self-imposed request for testing said that a citation ticket or no other monetary fines could be assessed to the HOA or the private ownership operation there if indeed the pool was found to be unsafe. That the county health departments would issue their rulings, their statements about the health of the pool, and the local private owners would then be free to act upon that decision or that information. So again, the purpose here was to further clarify that private pools do not come under the jurisdiction of the county health departments. That is the intent of the bill.
Thank you. Are you ready for questions?
Sure, absolutely.
Any questions from the committee?
Representative Jones, I heard you say that the unintended consequences I mean, could you?
Yes, I did. Yeah, I should have clarified when I brought that up. In the additional language that we added, looking at section 3B, we added, again, some language there to just, again, further strengthen that privately owned pools were not covered by the county health departments. But in reading this language, I became concerned that perhaps this language could be interpreted to say that the local county zoning folks would not have jurisdiction over zoning issues and actually the construction of pools. And that was certainly not the intent of this bill. And again, I would rather present a clean, clear bill for the committee to vote on rather than have that potential ambiguity that had broader implications that were not intended. That make sense?
Thank you.
No wave at the moment. Thank you, Mr.
Thank you, Mr. Chairman. Thank you, Representative Jones, for bringing this. I have a couple of different questions, specifically having to do with HOA type of environments. Having served on an HOA board, which is probably the most stressful elected position anybody could have. You know, when we had our pool, was always our biggest expense, and at one point there was a federal regulation where we actually had to drain our pool, replace the covers with a special type of cover that wouldn't suck the kids into the drains. You know, it was a federal law, but the local county health inspector was the one that actually enforced it for our HOA. How would this play out in that type of scenario? I mean, because obviously our county had that ordinance on file before the previous law, because our health inspector took a very active interest in our pool from the time it opened until today.
Again, the intention here is regulating the health of the pool in terms of water quality. Make sure that the water quality of the pool is safe. Really not having anything to do with either other safety issues or in the case of unreasonable attempts to require private pools to put lifts and other things that some of the ADA regulations suggested that private pools might be required to do. So this is strictly talking about the health and the quality of the water of the pool.
Well, I don't really see that here. Maybe I'm missing it, because I'm looking at Section 2, lines 29 through 38. It talks about inspecting the pool. It doesn't, and that's not really defined as just to the water quality. You know, one day our health inspector in Cherokee shut our pool down in our neighborhood because the fence had become damaged and would allow a child to enter in without controlled access. That would be another thing that happened to us. So, along that line of questioning, does this really just deal with the water quality, or is that your intent? Because I'm not seeing that in the language here.
That is the intent, really, again, the health of the pool. And I think that's why, in talking with the chairman and looking at the language that's presented, it wasn't quite clear that was what this bill was intended to do.
Thank you. I might have another question in a second. I'll let someone else go.
Thank you. Representative Bell, you got a question now? Okay.
So I wanted to go to Section 2 as well, and just trying to understand that I heard you correctly. So members of the HOA have a right to contact the county department and have testing of pool cleanliness or whatever we're looking for in that, correct?
That would be correct, yes, ma'am.
So, but if they find something negligent or negligible, they can't be cited for it, and then does it fall back as their responsibility to do whatever needs to be done? Or how do we hold them? We're not holding them accountable for fixing the issue?
They being?
The homeowners association.
Again, going back to the original premise of the original bill and the clarification I was attempting to achieve was that the county health departments do not regulate privately owned pools. But the idea being that those private owners could request an inspection just to help determine from an independent third party, if you will, the health and quality of the water.
Okay. Thank you, sir. I
Yes, ma'am.
appreciate it.
Representative Turner.
Yeah, so I do have another question. It says here also country club. So if would that be inclusive of something like a health club,
No.
like Lifetime Fitness?
The idea to not include health clubs is that those members do pay a fee, if you will, and there's more of a public access versus country clubs tend to be privately owned, and you've got an equity share in the country club and that type of thing. So that tends to be more of a private ownership, private equity entry into the country club versus health clubs. It's a fee for membership, so you've got more public access into those pools from health clubs than you would from a country club in your question.
Thank you.
Does that clarify?
Mm-hmm.
Thank you. Anyone else have a question? I've got several questions, but I think I'm going to hold off until we have anybody else that wants to testify in favor of the bill. Do we have anybody that wants to testify in favor? Okay. Yes, that'll be fine.
Thank you, Mr. Chairman, members of the committee. John Barber, representing the Georgia Association of Realtors. We appreciate Representative Jones' efforts to bring this bill forward. Actually initiated from a constituent issue with one of our realtors down in Glenn County in the area that Representative Jones represents. He, as a realtor, he was managing a condominium association, and part of his duties, he was on duty that day, and a local code enforcement officer came by, or could have been the health department. He came by and was instructing our realtor member on things that this condominium pool needed to have done. And some of these things were that he needed to have a water line for drinking water. And our realtor said, well, that would be prohibitively expensive to run a water line. You know, this pool is only open to the residents and our guests. If we want water, we go upstairs and bring our water down. And another example was they potentially needed to put a shower in. So there's a whole series of things that are regulated that a public pool is required to have that is not required in a private pool. In these conversations, the realtor member became frustrated every time he would say that, well, this would be prohibitively expensive and this is only open to our members and guests. It was met with the same retort that these are the things I'm going to require you to do. Since this was essentially a local issue at that time, I don't know if Representative Jones was sworn in at the time, Representative Atwood and Senator Ligon went to meet with their local health inspectors and were essentially told, well, we have the right to do this and we're going to continue to do it. So that was the genesis of bringing a bill forward to address it at the state level, because there seems to be some ambiguities within the law. Because what the law on the books today says what a public pool is. It does not define what a private pool is. There's a series of exemptions from what a public pool is not. And those are listed in the current law. They're apartment complex pool, country club pools. A condominium pool is not listed specifically in that list, so it is then treated differently, even in the state health regulations, when they in the definition of public pool in the state health regulation, which contains condominium, but you won't see apartment complex or country club pool in that list. So we have this anomaly with a condominium association, and the question is, why would it be treated any differently in the law from an apartment complex or a subdivision or a country club? And what we found with some of the local regulations on the books, including Glenn County, that were on the books prior to December 31st, 2000, which is the current preemption in the state law, is that Glenn County has a definition of a semi-private pool. So we have a private pool, a semi-private pool, and a public pool. And nothing in the state law speaks to a semi-private pool. So the intent of the bill is to try to clarify what is public and what is not. Because there's no intention from the Georgia Association of Realtors to infringe upon the regulation of public pools. We absolutely do not want to do anything that would restrict our health inspectors from having that ability. The intent of the bill and what we support in Representative Jones' efforts is to try to provide some clarity on what is a public pool and what is not, and then to protect the private property rights of the property owners, to make sure that they are not regulated to the point where they're forced to do things to their pool that would be equitable to a public pool when it's in fact a private pool.
Thank you very much. Any panel, any committee have questions?
Thank you.
I'd like to see if I'm correct on this, but prior to 2000, December 2000, is that right?
Yes, sir.
That you were grandfathered in, and if the county had control and had legislation, I guess, or rules in their county, then you would follow the rules of the county. And after that, then if they did not have any prior to that date, then after that, then the state law takes place. And so the incident that you had was where the county actually had jurisdiction because they were prior to the December 2000, right?
That's my understanding, yes, sir.
And so what we're trying to do is get the state to clarify what it is that the county should do. Is that a fair statement?
Our intent is to try to have an equitable treatment across the state, where from one jurisdiction to another, where we understand what is a public pool and what is not.
So you're asking then for the state to clarify the definition of a public pool, but not asking all of those people that are grandfathered in to change their rules to match Georgia law?
No,
And
sir.
to
We
follow
would
Georgia
like
law.
the local governments to all be on the same playing field, and if the state law is modified, for the local governments to then follow suit.
Okay, Representative Turner, good question.
Just to follow up, kind of the same lines that we were talking about a second ago, you had mentioned this water line issue, and Representative Jones had mentioned just about water quality. So what is your take on what the ultimate end goal here is? You don't want the health inspector coming out having jurisdiction over anything, or water quality, or are there any limitations at all that are okay?
Well, I absolutely want to follow the lead of Representative Jones, but the issue that brought this forth was not specific to water quality. It did deal with the inspector asking the condominium association to install a water line for public water and a shower, because those are certain things that are required in, if you, like, let's say a public park pool.
Okay, thank you.
So let me add to that again. The overriding premise in this thing is to define what is public and what is private, and in doing so, define whether local authorities have any jurisdiction whatsoever over private versus public pools.
Sorry for the interruption there, but I've been advised that we may have an issue with the fact that what this legislation is referring to is a state law that has this, actually this chapter particularly pertains to many, many other things other than just pool quality. It actually pertains to construction and upkeep and quality and everything else. So we may need to go back and look at that particular chapter again and see if you want to bring it more into the specific thing that you're asking and want to be done. But I want to clarify with you, if you don't mind, that your intent is to have no control by the local county as to what can or cannot be done, because you first started off, you said it was a definition of what was public and what was private, and then you picked out a couple of things that specifically that you didn't like, but under a private pool they would not have any jurisdiction at all, so therefore you're basically asking for the condominiums to be eliminated from a public and go to a private designation so that the county wouldn't have any jurisdiction. Is that?
I think that's a fair assessment. Code Section 314512 it's not the title of that is not in the bill, but the title of that code section is inspection of unregulated pools. And that's, to me, that says that we have a list of unregulated pools, and we essentially would like to ensure that condominium associations are included in that list of unregulated pools.
Okay, I think I understand. We have a question from who? You, Mr. Chairman, Vice Chair? Is that you? No?
No, sir. That would be the Secretary,
quick.
Representative Quick.
Thank you, Mr. Chairman, and you sort of hit on what I was trying to outline, which is that this is part of a whole separate code section that at some point was entitled Michelle's Law, which no doubt was named for a child upon which some tragedy had befallen, and there was a need for some state regulation of public pools. And so I think your attempts are to clarify what a government can and cannot do with regard to private property, is it not?
That's right. And thank you for that clarification, because if you go back to when this law was put into place, there was a tragedy in a public pool. So the initial law was put in place to ensure that there was proper regulation of those public pools. But then with the preemption language that was also put in the bill, essentially any local government that had an ordinance on the books prior to 2000, when Michelle's Law was put into place, would not be impacted by that law. So if they had something on the books that treated a condominium pool or a subdivision pool as a semi-private pool and not a private pool, then their local regulations would not be impacted. If they did not have something on the books before then the state law would govern.
Excuse me. What does the county, when it says semi-private, what are the rules on semi-private compared to private or public?
Well, excuse me, it's actually called a semi-public pool instead of semi-private. And this is Glenn County. Both the state health regulation and Glenn County define a private pool as by use not more than one owner, family, and their guests. So even the state regulation is specific that a private pool is only for one family and their guest. However, in the definition of the state law of what a public pool is not, then there's a list. Like I said, private pool is not defined in the law, and Representative Jones' bill does not attempt to define what a private pool is. It's more that there's a definition of a public pool and then what a public pool is not, which...
But the state law does not mention semi.
It does not.
But what does the county say? Did you have that?
You want to know how they define? It's like I said, I misspoke. It's actually called a semi-public pool. That says that that means that any pool other than public or private residential swimming pools, which is intended to be used collectively by numbers of persons for swimming or bathing and is operated by any person, be he owner, lessee, operator, licensee, or concierge, regardless of whatever a fee is charged for such use. Semi-public pools and spas may include pools for, but not limited to, hotels, apartments, motels, multiple housing units, condominiums, and also treatment pools, therapeutic pools, special pools, and water therapy.
So under their semi, they're calling it, they're still requiring that the county actually oversee that. Is that correct?
Yes, sir.
Okay, and the state does not have anything about semi?
No, sir.
Okay. All right, anything else? Okay, thank you very much.
Yeah, thank you.
We have anybody else in favor of the bill who likes to speak?
Good afternoon, Mr. Chairman and committee. My name is Rob Fortson. I'm here on behalf of the Community Associations Institute, which represents HOAs and COAs all over the state. I don't really have a ton to add to what John Barber just said on behalf of the realtors, other than to point out that as a policy matter, differentiating between apartment complexes and condominium associations doesn't make a lot of sense. And if you'll notice in the language that's actually crossed out in the current version at line 20 and 21, it refers to subdivision pools which are open only to residents of the subdivision and their guests. So if that's considered to be a carve-out, I think that the intent there possibly was to include condominium associations, but it just isn't explicitly stated, because if you've ever been to a Post Properties on a Saturday, that certainly doesn't feel very private. And yet, this law clearly says that that is not a public one, and yet a condominium association pool would be. So we're just, we believe these should be regulated exclusively under the law the same way that an apartment complex should be. And I guess that's all I have to say about it.
Okay. Question, Representative Turner.
Thank you, sir. You said that the Post Properties pool doesn't feel very private. Who owns the property?
It would be an apartment complex owner.
So the government doesn't own that property?
That's correct.
So it's private property?
Yes, sir.
Thank you.
Thank you.
Thank you.
Miss somebody? Okay. Anybody else in favor?
Mr. Chairman, I just wanted to speak briefly. My name is Hayden Stanley.
I prefer you come on up if you don't mind, so you can.
I apologize. I had not planned to speak. My name is Hayden Stanley, and our firm, 5 Stanley, represents the Georgia Apartment Association. We have for many years. We've been watching this bill. Thank you, Mr. Jones, for introducing it. We've been watching it, and recently got a copy of the substitute. We're going to continue to be involved. But I appreciate Representative Turner's point. Apartment communities restrict access to those private pools to their residents and the guests of those residents. So as you continue the debate, I just wanted to speak to you and let you know that we're very interested and will provide input as needed.
I do have a quick question. Would you determine that a condominium pool and an apartment pool, or for any particular reason, the definition would be different?
No, sir. Again, we represent the apartment industry, and others are here on behalf of the condos.
Okay. Thank you very much.
Thank you.
All right. Who's next? No? Okay. Anybody want to speak against the bill? Or speak in favor of or speak on behalf of the condominium? Either one. Come on up. We don't have to take them in any particular order.
Good afternoon, Chairman. I appreciate you giving me the opportunity to speak today. My name's Chris Rustin. I'm the Director of Environmental Health for the Georgia Department of Public Health. And one of the things I want to try to clarify a few things that's been stated today. First of all, we have a very strict mission. Our mission is to inform the public of environmental health hazards, to protect the public from illness and safety issues, and to prevent illness and injury through monitoring and inspection. That's our ultimate goal. As has been stated, this legislation was introduced in '99, that went into effect in 2000. During that time, when the first bill was introduced, none of these exemptions were in there, but through the bill-making process, these exemptions did get added. But the legislator at that time recognized that local county boards of health and counties that had rules in place at the time had made a decision that it was in the best interest of those counties to protect children that are primarily using these pools, which is why that original exemption was added into that law that allows these counties that had existing rules and regulations to choose to keep their rules and regulations. Most of the counties that are under their local rules and regulations follow the general standards of the State Department of Public Health's rules and standards. What we focus on is safety hazards. We look at the drain covers, as Representative Turner mentioned. One thing I want to mention about the drain covers is they do expire. These drain covers, as a federal law, are designed to prevent suction hazards, which was the original intent of this bill. A child got sucked to the bottom of the pool. These drain covers do expire, and as part of our inspection process, we do verify and make sure that these HOAs understand that they do expire, and at some point they have to replace them. Other things we look at is the fencing. We look at decking, all the safety issues around the pool. We ensure there's emergency equipment in these pool areas. That includes a buoy ring, a shepherd's hook in the event that a child was to fall in and have to be pulled out. And we also verify that the chemistry of these pools are in place, meaning that they have the correct chemicals in there to prevent bacteria illnesses as well as outbreaks of parasites that can happen in these types of pools. So with that being said, the Department of Public Health has some significant concerns, as I've expressed with Representative Jones. And this current version of this bill gives us more concern because now it takes away the local authority for about 88 counties, and this results in thousands of additional pools that will no longer be under public inspection by the health department. Just a couple of statistics that I've pulled from my own office. Based on the current pools that are inspected in the state, about 50% of the complaints and the risk that we see are in pools that are managed by HOAs. These are apartments, country clubs. These are these types of pools. Another statistic I want to mention is that Safe Kids Worldwide, the leading cause of injury-related death in children 1 to 4 is drownings. While I certainly respect the opinion of the legislators and the others that have spoken, we do have some significant concerns with the way the current bill is written, and we do feel like that it could reduce public health protection for many people using these types of pools.
Thank you. When you say you object to the way it's written, is that mainly the date issue, which takes away the grandfathering of the local legislation?
Well, that's certainly a major issue because now that would remove or add exemptions to every county in the state when there's currently about 88 counties that have the authority to oversee these types of pools. But I do want to try to clarify condominium. I know it's been mentioned that it's very similar to apartment complexes, and we somewhat disagree with that in the fact that, especially in our resort communities, on the beach and those kind of places, many of these privately owned condominiums and timeshares start off as private, but then they ultimately turn into second homes. They get put on the rental market, and before you know it, people are now on Craigslist. They're going to rental companies, and you now have the public that's renting these types of pools. So we do have a concern, and we do feel like just saying condominiums across the board throughout the state will take some protections from certain types of pools that the public is generally using.
Well, is there a way to define condominiums that do have rotating tenants versus those who don't?
That's something we would have to explore. I mean, we're certainly willing to meet with the interested parties to look at that.
The second thing is that if the county has jurisdiction, the state doesn't get involved. Is that correct?
Sort of. And that's the third piece I wanted to talk about, the administrative process. All county boards of health, regardless of what rules they're enforcing, are subject to review by the department. So, for example, if someone is concerned of a decision made by a county health department, they can appeal that decision to the Department of Public Health, and our legal counsel reviews that decision. One of the things that we do look for is it a common sense decision that was made? Was it made in the best interest of the public? And we can overturn decisions made by the county boards of health and have done that in the past. I would certainly like to see the administrative process work before a law is pursued that takes away what I consider some protections to the public.
Have you seen variations of the county's codes that they have? Are they really far apart? Like, does some call for fresh water, drinking water, and others don't?
The concern that was mentioned about drinking water, the rules and regulations do require a drinking fountain, which is the purpose of that water line that they had discussed, and it requires a deck shower. The deck shower is obviously to try to wash the body off before they get into the pool. So yes, that is in the current rules and regulations.
For the counties?
That's in most counties, and it's currently in the State Department of Public Health rules and regulations.
Okay. Thank you, Representative. You.
Thank you, Mr. Chairman. I've got a question here. Just to be clear, in your comments now, you're referring to your comments are directed at even privately owned pools.
My comments are directed at currently the department oversees the county regulations for about 77 counties. The way this current bill is written, it will now exempt apartments, country clubs, condominiums, subdivision pools from 159 counties. So what I'm speaking to is that those local counties that currently have the authority to regulate those types of pools made that decision in the best interest of their county because they determined there was a public health need for it. We have serious concerns with removing that and applying that across the board to all 159 counties.
Here's where I'm hanging up on this a little bit, though, and where my issue, I guess, would be maybe from the direction you're coming from. We're talking about private pools, but then you just reference a public concern.
Mm-hmm.
This isn't public. They're private.
In many cases, and I understand the way the law is written, and that's how we follow the law, it says the residents and their guests. And I understand that guests can be used in any term, but many of the complaints that we get are from the residents at these types of pools because they don't feel like the HOAs are taking care of those pools. Now, I understand the law is the way it's written, and we'll certainly follow the law. But condominium complexes, which is what the original bill was for, again, we've got a lot of our resort communities where condominiums aren't necessarily the private owner using them. They use them a few times out of the year, and they turn them over to the rental market, which now is open to anybody that can use them.
But ultimately, what we have in those instances are private owners and private ownership. Mm-hmm. And I would suggest that it would be up to the individual owners and that management company to do it, not taxpayers to bring in the county to come in mm-hmm. and take care of something that's not a public need. It's a private property issue. I get where you're coming from, and I appreciate that the health concern of individuals is one that's a priority for y'all. But in this, I don't think we need to get distracted away from this. Is ultimately private property. I mean, the government can't keep everybody from getting sick at a pool. I mean, just like if I'm having a hot dog that's been rolled around in the yard for 2 weeks and then the hot, I'm probably going to get sick, but there's nothing. I mean, I'm still at a pool. You know, you see my point. I mean, there's only so much the government can do. Mm-hmm. So I think that's an important point when we continue to look through this is private property.
And certainly the private property or owners have the ability to call the health department at any time if they so feel necessary. Is that correct?
They certainly do. And can I speak to that?
Yes.
If you will allow. In the 17 years I've been working in public health, and I've worked on the coast. I managed the Chatham County Health Department Environmental Health Program. We had about a little over 600 pools that we oversaw. I have never had a HOA type pool call the health department and ask for assistance to do inspections. What they typically do is call to complain about the problems in that pool. And then they get very upset when we tell them, well, we don't have jurisdiction. We can provide this service to you guys if requested by the HOA. But at least in my experience in the 3 counties and the 3 health districts I've worked in, I've never had that request. So I certainly understand that that's in there. But
Representative Turner?
Do you guys charge fees, or do you know if they charge fees for inspections?
Certainly. All health departments charge environmental health fees. Those fees are designed to offset the cost of services. The state also provides money to the health departments through grant and aid funds.
Roughly how much do you think they're charging if you had to, if you know, or
I would
range?
Not like to speculate. It does range because environmental health fees are subject to the Board of Commissioners' final approval. So every county, typically your metro counties will have higher fees than your smaller rural counties. So the fees could range across the state.
So how many inspections does an average county perform now
for public pools?
Yes.
Well,
that would I guess really, and let me narrow it down to what we would be excluding here. How much of a workload are we eliminating for these health inspectors?
Well, currently we have approximately 9,000 to 10,000 pools in Georgia that have public health department permits. I don't know the exact number that would be eliminated, but we currently do anywhere from 15 to 20,000 inspections a year on those 8 to 10,000 pools. And one thing I do want to mention is that while the counties do charge environmental health fees, these fees support an environmental health specialist, which is the inspector, but they don't just do pool inspections. They also wear many hats. They inspect your restaurants, your hotels, they investigate environmental complaints. They permit septic tank systems. So it could be a fiscal impact as well.
So, so we're using the inspections to subsidize the government employee in this case?
Environmental health fees are charged to augment the cost of services. That's correct.
Augment,
Yes.
above and beyond what it would actually cost to perform the inspection?
Not necessarily above and beyond. It's really going to be determined on each individual county what that fee is and how they came about determining that cost.
Do you know what they would charge in Fulton County?
I don't want to speculate. I can say that when I managed...
Is there any county that you are aware of
Yes,
how much they charge?
Chatham County. I managed Chatham County. If I'm not mistaken, we charged about $300 a year to do the inspection services for those public pools.
And for that $300, what exactly happens?
Okay, what happens with that $300 is that we provide education. They're certainly available for that. If it's a new pool, we do a complete plan review. And one thing that was mentioned earlier, we don't just look at the water chemistry. We do a full safety review of the pool. So we do a plan review on the new pool. We do inspections on the construction of that pool to ensure it was built to plans. And then when they're ready to open, we do what's called an opening inspection. Essentially what that means is that pool has to pass all the inspection elements to be able to operate. And then if it's a seasonal pool, during the swimming season, which is generally from about April to September, we do at least 1 to 2 additional inspections on that pool. If it's a year-round pool, if it's open year-round, we do a minimum of 2 inspections a year on those pools. So we're not in there a lot, but we try to get the most out of the inspection while we're there. It's really a snapshot of what we're seeing while we're there doing that inspection.
So $300 a shot. Would you say that's average, or?
I wouldn't necessarily call that average. Chatham's a fairly metro county. That's probably low compared to Fulton, the counties in the metro Atlanta area. And then when you get into the more rural side of the state, the fees are probably lower than that.
Thank you.
That's what the state charges.
No, sir. That's
That's
what
county.
the county health department charges for environmental health fees. The state doesn't charge fees.
Okay. In the event that these counties do not have their own and wasn't grandfathered in to have their own, and then it falls under the state, does the state charge?
No, sir. What happens then is they follow directly the State Department of Public Health's rules and regulations, and the county boards of health determine their own fees. So every county health department has a fee schedule for environmental health services that has to be approved by the county commissioners, and they determine their fees. And a lot of times they do comparisons to like-sized counties in the area. But the state does not charge fees.
They determine the fees, and the state does the work?
No, sir. The local county health department environmental health specialists do the work. They're an agent of the state, of the Department of Public Health, and they use the state rules so they're consistent.
That is a state charge, though, is it not?
No, sir. That's the Board of Health's a local entity that charges those fees.
And who does the inspection?
The local health department, environmental health staff.
So the state is not over the county?
The state is responsible for the rules and regulations. Those rules and regulations, and we provide the consultation.
You're over the rules and regulations. Right. You don't actually do the work.
That's
then.
correct.
Okay.
We don't actually do the inspections.
Right. I got
correct.
it. I understand. Okay, any other questions from the committee? Anybody else here to testify? Yes, ma'am.
Catherine Fleming with the Georgia Municipal Association.
Yes, come on up.
Thank you for having me here to testify. I won't go long since I know I'm between a lot of y'all and lunch. GMA is neutral on the issue of whether or not a condominium should be regulated as a private pool or a public pool. We appreciate the effort to clarify that with this bill. We do have serious concerns with the bill in its current state, and I understand that it's not the intent of Representative Jones, and we appreciate that. But if the bill were to pass in its current state, it would completely preempt local zoning of swimming pools. Zoning is what keeps your neighbor from putting a hot tub in their front yard, and I don't think that we want to preempt our local zoning codes. Especially when I look at this language, when I see therapeutic chambers drained, cleaned, and refilled, I'm not even really sure what that refers to. I don't know if that could be something at a massage parlor, but I don't think it's the intent to preempt our city's local zoning authority on swimming pools. And I look forward to working with Representative Jones as this bill moves forward, and happy to answer any questions y'all might have.
Any questions from the committee? Okay, thank you very much. And look forward to, I know Representative Jones looks forward to working with you. Anybody else? Nobody else has signed up? Committee, any comments? Well, again, like I said, you want to recap anything before we go, or?
Not really. Not really. Thank you all for the very good questions. You kind of helped actually clarify some of these issues for me too as well. But again, the clear distinction we're trying to make here is private property versus public property. That is the clear and overriding distinction. And the reason I've asked the chairman and I discussed not voting on this today is because, again, as I mentioned earlier, not wanting to circumvent local zoning in terms of the construction of pools. So just want to make that point. Again, we're talking about a definition between private and public.
Okay. Representative Bale, do you have a question? No? No, that's not you. I'm sorry. Okay. We have a motion to adjourn. Move in second. Thank you all for coming,
Thank
and
you, Mr. Chairman. Thank you,
we'll let
committee.
you know when we're going to speak on this again. Thanks.